us. It's all around mental health resources and things like that. And we connected at NACHO back in July. So this was just a great opportunity for him to kind of come and share a little bit of his work with everyone and share another resource with folks. So I'll go ahead and pass it over.
Thank you a ton, and thank you for your patience. I use my video every single call I ever do. However, I live in Tampa, Florida. We just got hit by a really bad storm. I actually literally lost my home in the storm.
Mm.
So I do not have a home anymore. I am in a temporary unit right now. Um, I am using my hotspot to do this meeting, so I know that if I put my video on, it'll glitch, but I have enough of a connection to at least do a screen share and share with you guys. And I didn't want to cancel because this has been in the works for a long time. So thank you for your patience with me not using video. I promise you that I'm a real human being in the world and I'm not like an AI robot. Um, and I'm really excited to share with y'all. Also, sorry if I'm not like my normal super upbeat self. I will definitely try to be as chipper as possible, but just being real with everybody, it's been one heck of an experience. But let me do a quick screen share. I want to first mention that if you're not familiar with me or Cope Notes in general, that's okay. We are new-ish. We are 7 years old, so we're just about to enter, I guess, the first or second grade. Um, and basically, the reason why I do this work in the first place is because I grew up with severe mental illness and I didn't want to talk to anybody about it. I didn't want to go to treatment, didn't want to take medication. Um, Certainly didn't want to talk to counselors or adults, much less kids my own age, about what I was going through. And then eventually I went to treatment so I could stay in school. And then that led to me going to college and getting a psych degree, ironically. And then I started working in behavioral health. I started doing advocacy with NAMI, National Alliance on Mental Illness. And I just really became passionate about, I studied neuroscience in school, like how the brain changes and why. And then I was also doing peer support with NAMI. So I loved like neuroscience and peer support, and I wanted to combine them to create something. So that's like the origin story of how Cope Notes even came to be 7 years ago. So if you're not familiar just on a very high level with what we do, this first page should explain it in like, this is how I would explain it to my nephew. We use text messages to improve mental and emotional health. So very straightforward. Obviously, there's not lots more like psychology and technology behind it, but that's very high level what we do. And quickly, I just want to share that I think the whole continuum of care has gotten this wrong, at least in my lifetime. I've spent a lot of my time either resisting care or seeking care, and both were really challenging. I think there's a lot of focus placed on people in crisis, and that's lovely. I'm grateful for those resources, but the idea that we should uh, wait for things to get to that point, or we just expect people to reach out when things get that difficult is just not reasonable. It doesn't track with real world experience. So the idea is that we should be supporting the entire population that we serve, whether they're experiencing mild, moderate, or severe symptoms, or none, even if they're living without a diagnosis. So basically, the heart behind what we do is um, why serve the people who are actively struggling and ignore the rest when we could potentially prevent struggling in the future? So we do a lot of intervention and prevention, and that's the heart behind it. Also mention that even though it's 2024, this is not an app. So there's nothing to download. This is like no software updates. You don't need to remember a password. You're not sharing your personal data with Apple or Google, so it's privacy compliant. This is all text messages. So again, I will repeat, this is not an app. It's all text messages, which means, there are a few reasons why we chose that. Number one, it is on the bottom left. You'll see it's literally 50 times more likely that you will respond to an app or a text message than an app notification. 50 times more likely. So we knew that if we're in the business of delivering health interventions, people actually have to read them. So we want to make sure that they don't ignore them or swipe to ignore them. Um, And then in the middle, you'll see this is actually true for all generations. There's a big misconception that, like, oh, that's good for youth or that's good for Gen Z or millennials. It's actually good across generations. A lot of people don't know that. A lot of people, actually, almost 100% of American adults prefer text messaging to any other communication method. But the bottom right is really our main point here. There are tens of millions of Americans who use non-smart cell phones. And a lot of people who do have smartphones, like my dad, he doesn't, you couldn't pay him to use a smart feature of the smartphone. He can call and text. So we really wanted to make sure that this was accessible technologically. So you do not need a smartphone to use this. You don't need a data plan. You don't need internet access. So really focused on health equity there. This is probably the page that you were hoping I would start with. So thank you for your patience. This is the page that explains like how we do what we do. So I mentioned that we use text messages to improve mental and emotional health, but this is how it actually works. So we send randomly timed text messages, just one per day at a random time. But I don't get what Lindsay gets. Lindsay doesn't get what Calvin gets. Everyone's getting their own text message at their own time. No two people are ever getting the same message at the same time. And these messages are not written by AI. They are written by real peers with firsthand lived experience overcoming mental health challenges. Then they are reviewed, edited, and approved. Oh, by the way, I'm a certified recovery peer specialist. So like that's my background. So all the messages are written by peers. Then they are reviewed, edited, and approved by mental health professionals. So these are researchers, uh, therapists, counselors, you name it. And then, so they're track with me now. Top left, they're written by peers. Bottom left, they're reviewed by clinicians to make sure they're based on proven psychology. So we're not going to text somebody like, have a good day, Nicole. You know, like all of the content is like psychology facts, journaling prompts, exercises, all based on proven psychology. The top right, I'm actually going to skip this and talk about it on the next page because there's a cool graphic. Um, but yes, randomly timed messages, you never know when we will text you or what the text will say. And on the bottom right, even though, and I want to be clear about this, this is not like a chat with a therapist or call a counselor type of resource. This is a digital journal. So we reach out to you once per day at a random time with some type of micro intervention. Then you can text back infinity times or zero times. And those responses are just like they would be in a physical journal. So they're not being read through, they're not being monitored by somebody, they're not being reported to somebody. This is your confidential, private journal where you can say whatever you want, whenever you want. And the reason why people do feel safe journaling in their text thread is because on the bottom left, you'll see it's 100% anonymous and confidential. And if you are anything like half the people I presented for, you're thinking, oh, yeah, but what if someone needs additional care? We already work with 988. We outsource all of our crisis conversations to them to make sure that if someone is in need of real-time support, they can access it. Believe it or not, I'm almost through the whole deck. So like we're making great time, everybody. Um, this page is for sure the most interesting page. I literally gave a TED talk about the neuroscience behind Cope Notes. I'm not joking. So this is like one of my favorite topics ever. I went to school to study this. Basically, what we do, if anyone on this call is like a psychology nerd, you're going to really appreciate this. What we do is called ecological momentary intervention, or EMI. And that's a fancy way of saying that we are interrupting automatic negative thought with catalysts for positive thought. So if you've ever read about cognitive restructuring or brain training, this is exactly that, but with a laser focus on mental and emotional health. So we're interrupting negative thought patterns with catalysts for positive thought. And over time, your brain forms new neural pathways associated with positive thought, coping skills, resilience. So we kind of jokingly say that Cope Notes is brain surgery without the scalpel because your brain is physically changing as a result of these micro interventions. But it only takes like 8 or 10 seconds per day to interact with, and you don't even have to remember to use it. You're not logging into an app. You're not opening a module or selecting anything. All you have to do is read a message that shows up on your phone. So this is literally a set it and forget it resource. You sign up for it one day, and from then on, we reach out to you once per day at a random time. And we have all different plans. Primarily what we have been doing lately is we serve large groups. So any large group of people where you're like, some people have mild symptoms, some have moderate, some have severe, and we want one resource that can serve all of them. Of course, we do have personal and gift and family subscriptions as well. So anyone on this call could go to our website and get a subscription for themselves. The one thing that I want to point out on this page is we do serve youth ages 12 and up, as well as adults of all ages. And a full year of daily support through Cope Notes costs less than one therapy session. So this is very, very, very affordable. That's like, I grew up in a low income household. I needed treatment. We didn't always have the financial means to achieve that. So I wanted to make this very accessible from the financial standpoint as well. But this, oh, I forgot we added this. So the page after this is really cool. This is still a cool page. If you are a data person or you're the person at your organization where you have to like report to your CFO, hey, we spent 10 grand on this resource and this is the outcome. We do have a dashboard where you can see engagement metrics. We do outcome surveys and reporting. So if you need to like justify this expense to whoever is holding the purse strings at your organization, we make it really easy to do so. We do have a dashboard like this that shows you all this information, and then we can also deliver custom outcome surveys where you're like, well, we really want to know if Cope Notes is helping with this or that. We can include that metric in the outcome surveys and do a custom report for you. So all of that, I'm sort of breezing through it, but it's all possible. And we do it for our clients all the time. Top right, it's super easy to launch. So if you're not really tech savvy, or if you're dealing with a population that's like not a bunch of tech whizzes, that's fine. I didn't go to school for technology. This is like a very low tech resource. So you don't need a lot of technical know-how. If you paid for 1,000 licenses right now, I could get you set up in 20 minutes and you wouldn't have to do literally anything. So it's very, very easy to roll out. But this is the page that I think most people on the call will care about the most. It's also the last page. I'm going to skip the testimonials in the interest of time, but we have a jillion on our website. So please, if you go to copenotes.com, there's a reviews tab. Please thumb through there and grab a box of tissues because some of them are really emotional, but we've seen tremendous, we've served tens of thousands of people all over the world. And we've heard incredible stories about these small little micro interventions making massive differences in people's lives. And on the bottom, you'll see we serve literally hundreds of partners all over the world. Really big folks like United Healthcare and NAMI and Humana, but then also really, really tiny local organizations, which I love serving. I think how we originally met y'all was we had a contract with like the Intertribal Council. In Michigan, it's like we get to do a lot of small and local and state projects as well as these big national ones, which I have a big heart for because I grew up in Oldsmar, Florida, so like a really small community, and I like being able to serve local communities. But what I'll mention here, the 86% metric, if you're a skeptic, you're probably like, yeah, right. Like how on earth? I mean, I've taken medication with a lower success rate than that. So you're probably pretty skeptical. And I understand that we've surveyed thousands upon thousands of Cope Notes users, asking them about their experience, but you're probably thinking, well, that's self-reported. Like, where's the real published in a medical journal, university study, like quantitative research? Where's that stuff? Good news, we have it. We have two published articles or two published research studies in medical journals. One is in the Journal of Medical Internet Research, and the other is in, drumroll please, the Journal of Mental Health. So we've done a lot of research over the years. What I want to point out, what you're seeing here on the left side, the decreased and increased, these are the findings from the Journal of Mental Health quantitative study that we did. And this is, I end on this on purpose. When you look at decreased depression, anxiety, and stress, you are probably thinking, Johnny, I hope to God that if you are running a mental health company, that it will decrease depression, anxiety, and stress. So the good news is we do that for people in the moderate to severe symptom category, which is great. That is impressive. But what I want to draw your attention to is the increased resilience, emotional intelligence, focus, and coping skills. Those outcomes were measured for people in the mild to moderate symptom range. These are people living without a diagnosis. That is what I'm excited about. That you can give one resource that takes 5 seconds to sign up for and 10 seconds per day to use, that will actually, and that has an evidence base that will drive positive health outcomes for the entire population you're serving, not just the ones who are actively struggling. This to me is the future of healthcare. It is focusing on serving the entire population, treatment, quote unquote, you can't see my air quotes, but I have them up, for people who are actively struggling, and then prevention and intervention for people who may struggle in the future. So, all of that to say, if you can't tell, I'm very passionate about this. This is my life's work. We've seen this transform so many lives. My dream of doing this presentation is not to practice sitting in front of my computer talking. It is that if there are 14 people on this call other than me, I pray to God that we receive 14 emails from people saying, hey, I know people who can benefit from this. My organization serves these people and I want to plug this in. I want to, like, I can't tell you how much it kills and breaks my heart to hear of organizations who say, come on, did you see that? You see it, just do that on me, right in my big ending spiel. Um, my dream is to receive emails from everybody, because all the time I see people say, yeah, it was at the end of the fiscal year and we didn't really know what to do, so we just like dumped a bunch of money into some program that we didn't know was legit, and then we never used it, or we bought water bottles for everybody, or we threw a pizza party. And I'm like, please don't do that. Please actually use something that is based on evidence, that has tens of thousands of people already being served right now, and put us to work. Like, we spent 7 years building something that now we know works. And our dream is just to plug it into as many communities as possible, to serve as many people as possible. So I'm going to stop sharing now, but what I will do is put into the chat, I'm going to put my personal email. Please don't add it to like sell it to a data aggregator, johnny@copenotes.com. And then also I will put a link to our website, copenotes.com. And then I will also say, before we do questions, if anybody wants to try Cope Notes for free, like you're like, that sounds interesting, give me a week and I want to suss it out for myself, please type your phone number in the chat. I will add it to our system. You'll get one text per day for 7 days. If at any point you decide that you don't want to receive the text messages anymore, just text the word stop in your Cope Notes thread and it will stop you. This will not charge you anything. It's just a way for us to share what we're doing with people. But I would love to just add your numbers so you can see what it's all about. And then please ask me a question or two if you're wondering about the program or people that we serve or outcomes or how we could potentially support your community.
Thanks so much, Johnny. Yeah, I remember when I first met you, like, I want to say 5 years ago or so, with that ITC Intertribal Council Michigan contract. And so when I saw you again at nature, I thought it would be a good opportunity. A lot of equity work is draining at times and can be definitely difficult. So I'm glad that we got to highlight this resource. I know there was one question in the chat, and then we can go to the hands up. One person was asking about the cost and if this was foiable information. So we have a few governmental organizations on the call. So that's always going to be a concern for us, is what's foible, Freedom of Information Act type of materials.
See, I thought you were going to make me Google foible,
Nope.
and then you didn't. You spelled it out for me. So thank you for that. And what's funny is government is our largest vertical, and I've never heard anybody use that term, but I have heard people ask me about freedom of information. So all of this is completely, we serve a lot of like governments and first responders and all of that stuff. If you want information about what is like foible, I guess. If you go to here, I'll put a link on in the main chat. I'll put copenotes.com/terms. I'll send you our legal page. And then I'll send you our privacy page if you want to see like the actual details. And then what is the cost? Dana, the most you'll ever pay for a Copenote subscription is $10 a month. And that's like if you go on our website and you're buying it for yourself. And then obviously, as you serve larger groups, the price goes down in accordance with how many people you're serving.
All right.
Also,
No,
I'll mention that I'm seeing the direct messages of people sending me their phone numbers. Thank you for that. I will add everybody's.
awesome. Thanks. So it looks like I got Nicole, then Dana, then Calvin.
Okay, cool. Thanks. Thanks for this so much. I definitely appreciate it. I was just curious, what does the process look like when you're working with youth? So obviously, I think this is really cool for all ages, but I always think about like those teen years in particular. So what would that enrollment process look like? Is there parental permissions? Like, how does that look from like a practicality implementation standpoint?
Yeah, great question. So, we do not require parental consent, and we
Okay.
have like contracts with school districts where this is live. So I'm not like positing that we wouldn't. I'm telling you that we don't.
Yeah,
Um, and a big part is because we collect no PHI, so no demographic information, no names, like nothing like that. All we have on file is a phone number. And the way that we usually see youth signing up is either through, we'll make a QR code, like if it's copenotes.com/YMCA or something like that.
sure.
A QR code for them, a landing page for them. Literally, all they would do is go to that link, they type in their phone number, 10-digit phone number, and press submit. That's it. That's
Oh,
like the
cool.
entire enrollment process. So we'll see this happen one of two ways. One is, you put up some posters, you pass out some flyers, you tell people about it, and they sign up on their own. Sometimes we receive a list of phone numbers from the organization we're working with, and we just upload all of them like in a bulk upload.
Gotcha.
And then one thing that we've seen work really well is, let's say, you have like care navigators, for example, and you're like, each care navigator works with like 25 kids. So when they're meeting with that child, they'll say, hey, um, we just got this really cool resource in. I want to share it with you. What's a good phone number for you? And then let's say, Nicole, you are the person that I'm working with. You would ask me, what's a good phone number? And I'd tell you my phone number. You would type it in to your own computer and press submit. So you'd type my phone number in, and then you'd say, Johnny, check your phone for a welcome message. And I'd look and say,
Okay.
hey, it popped up already. And
Yeah.
then that removes the barrier of like, oh, I got to go home and research this, and I'm going to lose this
Yeah.
fire, and I don't want to think about it. So we see a lot of, specifically when we serve youth, we see a lot of adults signing up the youth at point of care. And we actually have a video, like a 30-second explainer video that you can show them if they're like, wait, what exactly is it? You could just
Mhm.
press play on a video and then type in their phone number. So that way you're not tasked with like, oh, it's like a texting thing and I can't remember how to explain it.
That's great. Thank you so much.
Oh yeah.
Hey, to go.
Yeah, go right ahead.
Hi Johnny. I think I met you at NACHO and I took home one of your postcards or took back here. And so it's nice to hear you again. And first of all, I'm gonna go a different way. Um, you're just in my thoughts, and I listen to public radio and they talk about what's going on with the hurricane. And something in particular that I've gotten to understand is our problematic insurance systems. And as advocates for a fair and just distribution of things, I'm actually putting this in the chat, but there's a podcast that I've sent out to people just asking everyone to stay woke. Um, Most places ask us and make us have home or renter insurance. And when you read about the deeper system, about what's going on, and it's happening deeply for Florida now, but it's going to make its way here with climate change. It's going to make its way all over the place. And one of the best things we could do is stay woke and understand what's happening with the insurance system, so we can like try to figure out how to um, get in the way where it works for us. Insurance is supposed to be there to help you, and that's unfortunately not what's happening. So I'm glad that you're safe and healthy, and just best to you. And the next thing I would say, back on track, is so this is important because we've talked about the mental health in our chips and chas, and that's been one of our focuses. And sometimes I think when people hear mental health, they automatically go from A, mental health, to B, a therapist. But that's not always what's
Mm.
best for a person. And people need these type of methods to also be heard or have someone to talk to. So I think it's great what you're doing and that you're out here. And, I'll look at the subscriptions as well, and also could see a plethora of advertisements for people who need mental health support, from where a therapist is to they could have access to things like cope notes, etc. So that's all.
Yeah, Dana, you just reminded me to share. I just put a link in the chat, copenotes.com/care. That one pager explains how we fit into the continuum of care.
Yeah,
So
awesome.
primarily we fill three gaps. One is pre-care. So like, I'm not trying to talk to anybody about this. Intercare, as in maybe I'm not engaged or I'm not showing up or I need help between sessions. And then of course, aftercare, you're all familiar with, but you just reminded me that like I wanted to share that because we play well with others. This is not like the way we describe it is, if you do want to go see a therapist, that's awesome. That's like going to the dentist. We are the toothbrush and floss, like the simple, easy, cheap thing that only takes a minute here and there, to keep yourself in shape between those visits.
Thank you.
Melvin?
Hello, Johnny. Great presentation, man, and I'm thankful for having to heard you present. When COVID hit, it was a lot of shelter in place, right? Shelter in place happened, and so a lot of mental health facilities closed down, and so those of us who were servicing those individuals who were attending those facilities were left with like figure it out. You know what I mean? And so
Yeah.
um, and so and in the population in which I traditionally have serviced, prevention and intervention is like is key, you know. And so a lot of the times the individuals we talk about lived and living experience individuals, they don't necessarily have the tools to be able to, adequately disseminate, if you will. So I like the fact that you partnered with, psychological services, if you will, to solidify the information that is being sent out, so to speak, you know. And so with that, I just got a question, and it's a question like that's been like bothering me between mental health and trauma, right? And how we deal with like the trauma that often leads to many different mental health conditions, right? Right. So do cope notes actually deal with like trauma, you know what I'm saying? And so that we don't, like Dana said, go from like A to B, you know what I'm saying, from mental health to therapist or psychiatrist, you know what I mean? The population in which I service, we we are beginning to understand, if you will, the need for some emotional intervention and prevention work, but it's still, when you put mental health, it's a trauma that is attached to that, that barrier that we're looking to overcome. So trauma, we all experience, it seemed like to be a term that kind of like doesn't take you from A to B or C. It's present, you know what I'm saying? And so how do cope notes actually offer, like, just for instance, what's going on with the hurricanes, across the country? How can we send positive messages? Do cope notes allow for that? I guess is what I'm asking.
Yeah, so a few different answers. First is, we do have people on our clinical oversight panel who are like trauma therapists. So like we try to make sure that the content is reviewed by those folks. But we also don't send targeted messages. For example, we wouldn't send a message about addiction necessarily, but we would send a message about what we turn to when we're stressed and forgiving ourselves and other people and effective self-soothing mechanisms. So we might not send a message about a hurricane, but we'll send a message about coping with change, accepting help from other people, stuff like that. So we try not to ever be too on the nose to trigger people, but we do try to work to make sure that the content is at least adjacent to those experiences so it's applicable.
Sweet, like that. And thanks for helping me identify the triggering of people.
Anyone else have questions about Cope Notes or things that you want to share? Well, I really want to say, thank you so much, Johnny, for making the time, especially given the hurricane and finding a new home and really all of that. And I just want to, lift you up, and I hope that everything works out really well. I know a lot of people in the chat have shared kind words with you. Um, so I just want to say thank you for that. Um, I will also email out. Oh, sorry, Pansel, go right ahead.
I just have a question about
Mhm.
given the recent tragedy with our police department in Detroit, do you is this have do you have law enforcement agencies that have access to this kind of um, support? Just a question, since we just recently had a caught by suicide in Detroit.
Mm.
I did see that. Yeah, that was very heartbreaking. I don't know, Johnny, have you partnered with any law enforcement agencies, anything like that?
Yes, we have, and we would be happy to serve there. That sounds awful.
Um, anything else that folks want to share or uplift? I'll be sure to grab the links that Johnny shared in the chat along with the email info so that everyone has that. And it sounds like quite a few people signed up for the free week to see how it goes. It's an excellent resource from what I remember on the projects I've worked with it in the past. And so I assume it has only gotten better. So yeah.
I just appreciate the opportunity to share with everybody, and I will just ask you this. If you have stayed here for the past 36 minutes and you're like, Johnny, I've tried every which way, I have no clue how to make this work with my organization. Like, there's just no way we could plug it in. The greatest gift you could give us as a team is an introduction to somebody who could put this to good use. There's, just like Pansel mentioned, there are organizations and communities all over the place that really need support right now. So if we can serve you, please email me and put us to work. If you can't wrap your head around any possible way that we can serve you and the people that you serve, please do me the honor of making an email introduction to somebody in your circle that we can serve.
So
Oh, Jason, we are a sole source provider and we have a sole source letter if needed.
um, wonderful. That was really all I had planned for today. I really wanted to provide additional resources and support, things that align with what's important to you all, um, things that feel like they are in time. So, as always, if there are other things that you want to utilize the office hour space for, please let us know. Otherwise, I'm just finding things for us to work through. And if you need anything,